Now, I mentioned earlier the fact that there has been 800 and something new substances developed in the last 10 years. So obviously, when we started developing the guidance, it was impossible to cover them all. Nobody is going to be an expert in all of these drugs. And the second issue we thought about is future-proofing our work, because as substances continue to emerge all the time, a new substance will be developed as we are talking, so we have to provide a way to be able to tackle all these issues. So in order to do that, we developed a sort of two-pronged approach, as it were. The first part of our approach was to classify drugs in ways that clinicians are very familiar with. As you know, you can classify substances in a number of different ways, by the chemical structure, by this, by that. But what we chose to do as part of with the expert group is to classify drugs through classifications which clinicians working in the field and other practitioners are very familiar with, which is the primary psychoactive effect, which obviously would be also the effect on body and brain. So we divided the drugs as stimulants, or primarily stimulants, primarily depressants, hallucinogens, and we decided to put synthetic cannabinoid receptor agonists, or SCRAs, as we want to call them, as a separate group because of the big differences that exist at the end of the day in the management of these drugs to others. And also within this group, there are lots of very differences in looking at them. So any practitioner or any clinician sort of coming across a drug they know or they do not know would be able to orientate themselves on how it operates by looking at this framework. And incidentally, I mean, one of the things that we know has happened in recent months, we have been hearing a lot about, I think it's called monkey dust, and people have been asking, what this is all about. In fact, this framework sort of provides a way of looking at it, because it's a stimulant, because it's a synthetic cathinone, by using the guidance and the e-learning modules, which I'll talk about later, will allow you to understand how to manage substances which are new.